Okay, we will move on with, we have two more sessions. Dr. Leandro Pellarin, plastic surgeon from Sao Paulo, who will talk about when to refer and current techniques in facelifts and rhinoplasty. Dr. Pellarin is a top surgeon. He's a master in plastic surgery in Sao Paulo, and he visits us as skin experts.
I would like to start by thanking the conference organizers and staff for their hard work and dedication in putting together this excellent event. I would especially like to thank Danny Tuma for the invitation and support. It's an honor to be here today. I will talk about rhinoplasty. My name is Leandro Pellarin. I am from Skin Experts Polyclinic and from Brazil. I have no disclosure. The nose is a complex and delicate structure that requires a balance between aesthetic and function. Here is one example of primary rhinoplasty, and here is another. When we think about rhinoplasty, we base it on three pillars: improvement of facial proportions, improvement of nasal relief, contour in areas of light and shadow reflection, improvement of respiratory function through the correction of areas of narrowing in the nasal airway. The first pillar, improvement of facial proportions. One way to measure proportion is by dividing the face in three thirds. The nose influences the middle third. Here we have an example of long nose, short nose, and balanced nose. The goal is to create a nasal contour that is proportional to the facial thirds. The nose exhibits areas of light reflections and shadow that convey its volume, delicacy, and shape. Rhinoplasty is indicated for patients in who such features cause discomfort and can provide an improvement in facial harmony. This is our second pillar. Our third pillar is improvement of the respiratory function. The same structure that gives shape to the nose also defines the nasal airway and may create points of narrowing in the airflow passage, like we can see here. The nasal structure is composed of nasal bone, nasal septum, upper lateral cartilage, upper and lower lateral cartilage. When covered by the skin envelope, these structures are responsible for the nasal contour and shape. Such a reduction can be done, but the nasal dorsum must be reconstructed with cartilage grafts such as spreader grafts. Spreader grafts provide a structural balance as well as improvement in the shape and improve the areas of light and shadow reflection. In patients with droopy teeth that elongates the nose, we need to elevate the tip by changing the tip support, like in this case here. And in patients with an over-rotated tip and a tendency for hyper-rotation, we must avoid increasing the nasal rotation angle and stabilize the tip. For this objective, we use columellar strut grafts or septal extension grafts to provide adequate support and position of the tip. Currently, in both primary and revision rhinoplasties, we use cartilage grafts with engineering-based physical principles to create stable and precise structures. The first options for grafts are the septum, but sometimes it's not enough. In these situations, we will harvest cartilage from the rib cartilage. Here is one example. A small incision. In 10 patients, we can do a very small incision, 1 centimeter. We will undermine the layers. We will undermine the rib cartilage here. We will do a chondrotomy here, medial and lateral, undermine the posterior area, and remove a piece of cartilage. Here is a small incision. In the initial planning of rhinoplasty, preoperative photos are essential because we can compare the pre and post images to compare what we did, like in this case here, or in this case here. And we can do the simulation. It is very, very important to program. We can overlay the preoperative photo with the simulation to generate precise measurements of the modifications to be made. And during the surgery, we can use measuring instruments to perform such modifications to be more precise and predictable. Here we can see the simulation in 1 year post-op. Another example, simulation in 1 year post-op. I prefer the open approach. We do a small incision in the columella. And we will undermine the skin envelope. Here we can see. It allows better visualization of the anatomy and greater use to the techniques and increase the previsibility. Here we can see using a technique for septoextension graft. In this technique, we remove a small piece of cartilage from the anterior septum, and we will put a septoextension graft and fix it to improve the T position. We can use grafts for alar reshape, like spreader alar grafts, like here. Another option is the use of partial dermal division, a technique for tip refinement. In this technique, we will remove a small piece of cartilage from the upper lateral, a triangular, and with this technique, we change the position of the lateral crura, improving the shape and the function of the external valve. Here we are after the cartilage resection. We will connect all the structures, improving the shape and the function. Currently, to modify the bone structures, we use the piezo, an ultrasonic scalpel designed for performing osteotomies. Here we can see the piezo, and I am doing an osteotomy. Here we can see some examples using this principle for changing the facial balance, the shape of the nose, and the shadows. We can use this exact example in secondary rhinoplasties too. And the same principles we can use for reconstruction in trauma and in oncological surgery like this.